Hi, let's talk about heart features, both external and internal. The external features of the heart give us clues as to what's going on within it. So, for instance, we have the coronary sulcus, in which the coronary arteries and portions of the cardiac veins rest, and that's going to help divide what would be the atria from the ventricles below. Outpouchings of the wall of the atria are called the auricles. Auricle means ear, so these are the ears of the atria. And then we have the interventricular sulci, and here we can see the anterior interventricular sulcus. And so often, these sulci are occupied by elements of vasculature. And we can also see the great vessels. So the great vessels are the vessels which either deliver blood to the heart or away from the heart. So feeding into the right atrium are the inferior vena cava and the superior vena cava. Leading out from the right ventricle is the pulmonary trunk, going up into the pulmonary arteries to the lungs, and then leaving the left ventricle is the ascending aorta. On the opposite, or the posterior side of the heart, the pulmonary veins are going to return blood to the left atrium. So here we can see the cadaveric view of the heart, the coronary sulcus, the anterior interventricular sulcus heading down towards the apex of the heart. And so we have an idea of where the different chambers of the heart are due to these two sulci. So we have our right ventricle on this side of the anterior interventricular sulcus and inferior to the coronary sulcus. We have our left ventricle on the opposite side of that interventricular sulcus. And then we're going to have the right atrium, as evidenced by the auricle there. And the left atrium is a little difficult to see in the anterior orientation because most of that left atrium is posterior within the heart. So that right atrium is going to receive blood through the superior vena cava and the inferior vena cava. And then that blood is going to move from the right atrium through the tricuspid valve into the right ventricle. From there, blood will ascend up through the right ventricle and through a pulmonary semilunar valve into the pulmonary trunk, which then divides into the pulmonary arteries. And then that blood will return via pulmonary veins into the left atrium. From there, blood will move through the bicuspid or mitral valve to the left ventricle. And then that blood will be squeezed during ventricular systole from the left ventricle up through the semilunar aortic valve and into the ascending aorta and out to the remainder of the systemic loop circulation. Here we can see a posterior view of the heart, still some of the great vessels. There's the superior vena cava, the inferior vena cava feeding into the right atrium. We can see the pulmonary arteries, which would be fed by the pulmonary trunk, which is coming from the right ventricle. Here are the pulmonary veins that are returning blood, richly oxygenated from the lungs, to the left atrium. And then here we can see the left ventricle, which is ultimately going to squeeze blood out through the ascending aorta into the arch of the aorta. Looking within the heart, we can actually visualize these chambers through a coronal section. So we can see the right atrium, we can see a little bit of the left atrium, and we can see the right ventricle and the left ventricle here. And so here's the coronary sulcus. There would be the anterior interventricular sulcus that's evidencing the interventricular septum. and thus the orientation of the different chambers of the heart. Now within the atria, we have a scant amount of muscle that's arranged in lines. And this muscle is called pectinate muscle, and it's present in both left and right atria, and it's more anteriorly oriented. The posterior aspects of both of the atria are rather smooth. And this is to allow for a lack of turbulence as blood enters through the vena cava. In the wall that separates the two atria, which would be approximately here, behind all of this, is the interatrial septum. And there's a slight indentation in that septum called the fossa ovalis, which is a remnant of the foramen ovale. The foramen ovale is an opening between the atria, which allows for blood to move and skip the pulmonary loop during in utero development. In the womb, a fetus isn't using its lungs to exchange oxygen and carbon dioxide. This is occurring through the umbilicus and the placenta of both the fetus and the mother. And so there's a great advantage to shunting blood immediately into the systemic loop. But that's something for another lesson. Within the ventricles, we have atrioventricular valves. On the right side, we have the tricuspid valve, and on the left side, we have the bicuspid or mitral valve. These valves have leaflets that connect to tendinous-like structures called chordae tendineae. And these chordae tendineae are anchored to extensions of the myocardium called papillary muscles. The walls of the ventricles have meaty beams or ridges of muscles throughout called trabeculocarni. And so blood during atrial systole or during diastole will move from the atria into the ventricles. And then during ventricular systole or contraction of the walls of the ventricle, these valves are going to shut and blood will be shunted both through the semilunar pulmonary valve and the semilunar aortic valve up to the pulmonary and systemic circulatory loops, respectively. So each of those semilunar valves are named for the vessels that they're leading into. Here we can see an opened right ventricle. And so here is the opening for the superior vena cava. Here's the opening for the inferior vena cava. So blood would be drained from the upper extremities, head, neck, and thorax that way, and from the lower extremities and abdominal pelvic cavity that way. We also have blood coming in from the cardiac veins that feed into a coronary sinus there. So all blood ultimately returns into the right atrium. Here's the rather smooth-walled sinus venerum. It's difficult to see the papillary muscle, but it would be located deep here on the anterior aspect of the heart. And we are able to see the fossa ovalis in that interatrial septum. So blood is going to travel through the tricuspid valve, which we can see a part of here, down into the right ventricle. That right ventricle is going to house the chordae tendineae and papillary muscles. And then when we go through ventricular systole or ventricular contraction, blood is forced superiorly up through the semilunar pulmonary valve and into the pulmonary trunk, which is going to feed into the pulmonary loop. So we're taking that relatively deoxygenated blood that's returned back from metabolically active tissues, and we're sending it out to the lungs so that we can offload carbon dioxide and onload oxygen. Here is a posterior view of the heart with the left atrium opened. So we can see the left atrium has been windowed here. We can see pulmonary veins flanking the left atrium, returning richly oxygenated blood from the lungs to the heart. And we can see the cusps of the left atrioventricular or bicuspid or mitral valve that's then going to lead into the left ventricle. Here we can see an opened left ventricle. There's the bicuspid valve. Here are some of the chordae tendineae coming down to attach to papillary muscles. There's an anterior and a posterior papillary muscle, one for each cusp of the bicuspid valve. Blood is going to travel inferiorly from the left atrium into the left ventricle, and then that blood is going to be moved out via the ascending aorta. But before it gets there, it needs to go through the semilunar aortic valve. And then it's in the ascending aorta, which is the feeder into the systemic loop. So we've talked a little bit about the external features of the heart and about the internal features of the heart. And what I'd really like you to mentally review is the sequence of blood flow to, through, and away from the heart. So to recap, we have blood entering the right atrium from the superior vena cava, the inferior vena cava, and the coronary sinus. That blood travels through the tricuspid valve into the right ventricle. From there, the blood moves through the semilunar pulmonary valve into the pulmonary trunk, which divides into the pulmonary arteries, is distributed to the lungs, offloads carbon dioxide, onboards oxygen. Blood is transported back to the heart via pulmonary veins into the left atrium. Blood then moves through the left atrioventricular valve, aka the bicuspid or mitral valve, into the left ventricle. From there, blood moves superiorly through the semilunar aortic valve into the ascending aorta, which feeds the systemic loop. Thank you.